Medical humanities represents an interdisciplinary field of humanities, that's literature, philosophy, ethics, history, and religion, social science, which is anthropology, cultural studies, psychology, sociology, and the arts, and that includes the literature, theater, film, and visual arts, as well as their application to medical education and practice. The humanities and arts provide insight into the human condition, suffering, personhood, our responsibility to each other, and offer a historical perspective on medical practice. Attention to literature and the arts help to develop and nurture skills of observation, analysis, empathy, and self-reflection, skills that are essential to humane medical care. The social sciences help doctors to understand how bioscience and medicine take place within cultural and social contexts, and how culture interacts with the individual experience of illness and the way medicine is practiced. Humanist, the word, is derived from the 15th century Italian term Umanista, meaning a teacher or scholar of classical Greek and Latin literature and ethical philosophy. The Humanista subjects of study include grammar, rhetoric, poetry, moral philosophy, and history. The humanist is trained to speak well and write. First, he or she masters grammatically the language, and secondly, attains eloquence or rhetoric. Humanism deals with human concerns, dignity, rationality, and capability. It ethically endorses human rights. It comprises a body of literary knowledge and linguistic skill. There are three philosophical categories of humanism. First, the religious humanism, which promotes the traditional social role of religion. Second, secular humanism, which regards all forms of religion to be superseded. And a third, moderate approach to humanism is its recognition as a life stance. All three categories reject deference to supernatural beliefs. They seek truth through reason. They endorse the scientific method via the best humanly observable evidence and refrain from considering the issue of immortality. Their goal is to make life better for all living humans and to promote concern for the welfare of others and to the planet, thereby focusing on doing good, living well, and leaving planet Earth a better place for future generations. In sum, humanism denotes a life stance which upholds ethics, justice, and scientific reason and rejects pseudoscience, superstition, and supernaturalism. Let's talk about ethical humanism. In 1877, humanities was used for the first time in America to describe Felix Adler, who was a rationalist, intellectual, popular lecturer, religious leader, and social reformer. He founded the ethical culture movement, a term that is presently used interchangeably with ethical humanism. The American Humanist Association was organized in 1941. The International Humanist and Ethical Union represents more than 40 countries as the World Union. In 2002, the International Humanist and Ethical Union adopted the Amsterdam Declaration, which is the official defining statement of world humanism. Educational humanism, which dominates U.S. school systems, holds that educational development of human intellect is based on what makes humans most truly human. In the United States, there should be more emphasis placed on the humanities, thereby better preparing potential future doctors to tackle sundry ethical and medical issues that involve patients and society as a whole. medical humanities deals with physician concerns, dignity, rationality, capability, ethics, literary knowledge, and linguistic skill. It should be more emphasized in the core medical curriculum.